Did you know that gallbladder dysfunction is actually one of the top reasons for admission to hospital in the first 12 months roughly after birth? Hi Mama, and welcome to this week's postpartum video/blog. I'm Tara. So, gallbladder dysfunction, it can actually start during pregnancy. And the big question is, why are so many women affected during pregnancy or after birth? So firstly, when we feel hunger, this signals salivary glands and hydrochloric acid into our stomach, which helps break down the food into digestible pieces. The food particles then move from the stomach to the small intestine. And then the gallbladder, which is the storage container for the bile, it releases the bile into the digestive tract, and it helps break down what you're eating into easier forms so that you can digest and absorb nutrients for your body. The pancreas also works with the gallbladder, and in the small intestine they work together and it releases the digestive enzymes. So gallbladder does the bile, pancreas does the digestive enzymes, and together they break down the food even more into nutrients, which are then absorbed and transported through the body. So bile is described kind of like a detergent. It helps break down fats so they are more easily absorbed. And quality fats are incredibly important for the absorption of fat-soluble vitamins like vitamin D, vitamin E, and vitamin K. And also healthy fats support hormone balance. They also help cells and tissues repair and are really necessary for breastfeeding as well. So fats are really vital in a postpartum diet. Don't be scared of them. So when the gallbladder isn't functioning well, it can actually back up into the liver. The bile, the liver and the gallbladder are connected. And so this can cause gallstones. They're seriously painful. Even though I've not personally had stones, I have had 2 gallbladder attacks after my 5th baby, and my goodness, it was excruciating. So gallstones are one of the major concerns in postpartum women, and even though there's still not a lot of evidence as to why these form, the health professionals can be a bit stumped about this. It's thought that it's when the bile contains too much cholesterol or bilirubin, possibly, and the gallbladder isn't emptying properly. So inflammation happens when there's a lack of blood flow to the gallbladder. Infections can occur when the bile is not flowing properly or it's blocked in some way. And it can lead to surgery, and that's the removal of the gallbladder, which isn't ideal, but sometimes necessary. So the question is, why are women in pregnancy and postpartum at such an increased risk with this, and how can we prevent it? Well, to be honest, many health professionals, as I mentioned, don't really know or understand the root cause. But with the research from Miranda Bauer, who's my mentor and whom I've studied the postpartum nutrition with, has come up with these 5 main points as underlying root causes in all the research that she's done. So number 1, the health of your gut microbiome affects gut function, right? So if someone has something like leaky gut, most likely they will have a gallbladder issue because of inflammation. Inflammation affects the bile moving from the liver to the gallbladder. Number 2, inflammation is triggered by gluten and dairy. So, sorry to break it to you, there's just so much evidence that supports this though. And stress, amongst other things, can also cause inflammation. And we're mostly all leading fairly stress-filled lives, and then add a baby into the mix. Number 3 is liver functioning issues. So when the liver isn't functioning well, it will affect the gallbladder, and vice versa. And number 4, medications like contraceptives, antibiotics have also been associated with gallstones, and pregnancy hormones, because they're fluctuating, can contribute. So these 3 things affect the microbiome. And then the birth procedure is the number 5, because our digestive system changes so much from the birth, as I've talked about a lot. And if you're sticking to your normal diet, you're eating processed foods or highly fatty foods that aren't good fats, it's going to affect your gut health, and not going to be digesting nutrition, and it's going to begin a spiral downwards. So by being aware and educating and being educated, making better choices through your pregnancy and childbirth and beyond, hopefully we can avoid these gallbladder issues and avoid the removal of them. The removal of any organ is ideal, like the prevention of that. So yeah, as they say, the prevention is better than the cure. So this is a reminder, I'm not a health practitioner or a naturopath, and these are only suggestions, and you can certainly check with a qualified naturopath or health practitioner to discuss. But having things like dandelion and bitters will support liver function. So keep eating good quality fats as well, including things like avocado and coconut oils. They're the best too. And ensure that you're having vitamins K2 and D as well. So really try and avoid processed fats like hot chips, yes, as yummy as they are, I know, or other fried foods, especially in those first few months of postpartum. It might only be temporary, but just do your body a favor and honor it after having a baby. Even if you're months or a few years postpartum, if you're needing to come back to healing, just honor that for that time of healing. The nutrition plan that I guide you through has been thoughtfully and carefully and thoroughly put together to help bring mothers back to balance and well-being, and it supports your digestive and gallbladder function. So reach out to me if you have any questions about what I've shared today, or if you're curious just to know more about the postpartum nutrition plan. I'm really excited to be able to offer this to you and to help so many mums, because I know what it's like to be depleted and to have health issues and gallbladder issues and not know who to turn to, where to start and what to do. And this has been designed specifically for you, mama. All right, take care. Tara from Postpartum Nurturing, and I'll talk to you soon. And be sure to reach out if you've got any questions. Bye for now.